Our final speaker tonight is Dr. Tayak, and we're going to ask her some questions about COVID-19 in the context of mental health. Many of us listen and hear about the consequences of mental well-being and the impact that COVID has had on people's mental health. And I wondered if you could talk to us a little bit about your thoughts on the risk versus the benefits of current restrictions on the mental health and well-being of the general population, those who are locked down quickly and for long periods of time. And are these mental health concerns being taken into account when we're implementing the elimination strategy or something else?
Yeah, so this is, my thoughts are that it is actually quite complex. So we've got data out there that indicates that the elimination strategy is it is the better strategy if we take into account, reduced road traffic accidents, the impact on health as well as costs. However, there's also information out there that indicates that we've got vulnerable populations, and we've got very specific groups who are much more vulnerable than others. And I think we don't know enough about that yet. A lot of the information that's out there, to my knowledge, is based on early COVID data as well. So we don't know what's happened since then. We don't understand everything since Delta has come along. And we know that people out there are mental health issues. So some of the international work that's come about, I think there's eight countries that we have very good data on, but it's from early COVID data. And that shows that, yes, there has been an impact on things like anxiety, depression, post-traumatic stress disorder. And then we've got some good Australian data, but it's in very select areas. So we know that there's increased medication use for mental health issues, and we also know access to mental health services has really changed. So compared to like 2019, there's been like a 10 to 30% increase in services. And I don't know if any of you, so just in the news recently, we've heard about Lifeline. So Lifeline, it's an organisation that's been going for 57 years or so, but in August, there's been 4 days that they've had the highest numbers ever of access. So these sorts of things tell us that something is changing in relation to people's well-being and their need to seek support. And I guess based on that sort of information and work, we've partnered with Wesley Medical Research to have had a unique opportunity to look at rural and regional mental health during COVID. So, and that's one of the vulnerable groups, and we know that access to services or things aren't quite the same in those areas of Australia. And that's one of the vulnerable populations we know are affected by COVID and the restrictions that come about. So what we've had the opportunity of doing is, in the middle of last year, we went into the Bowen Basin, which is an area where there was a need to develop a new service. Things weren't quite working there, and we got to partner and talk to a lot of the communities there and a lot of organisations. And two of the key things that we found were that not only was there a lack of access to services, but some of the services there, they weren't delivering mental health services in the right way and at the right time for people. So people were telling us stories like that in one town there was a mental health service, but it was in the middle of town. And so people were reluctant to go there because there was a huge car park out the front. So when they parked their car there, everyone in town knew they were visiting that service. So they said, well, none of us are going to go there. So the service was there, but they just weren't using it because of the stigma they felt was associated with that. And then there were other services, they were funded, but no one had ever heard of them in town, so they had no visibility. So they'd arrived, but they didn't tell anyone they were there, so no one could refer to them. So these stories came out over and over again. So we really got a very good feel for what people thought worked and what they didn't. And we've now developed a new model. So that model, two of the key things in that are that we provide a support person, so a navigator, a care navigator that helps people to navigate where they need to get to. And also that person helps them to find the service that works for them. And sometimes that's telehealth, so we're looking at introducing telehealth services, but we know that doesn't meet everyone's needs, because in rural areas, up to 8% of the population, they won't have an internet service. And we know certain groups of people, like farmers, they don't really like connecting using telehealth. So it's part of the solution. So we've tailored a new service to meet the needs using different things that sort of a package of services that weren't all brought together in the past. And the first Care Navigator has just started this week in Moranbah, so we're really excited that started. And we're really hoping that we'll be able to roll this out into other towns in that area. And we think it really does have the potential to be scaled up much broader, because a lot of the issues we were hearing about, they're not just in rural and regional areas. We hear about them in metropolitan areas as well. So we think there's a lot of potential with this sort of model. So we're just looking at funding to be able to roll it out in different areas and scale it up.
Thank you very much. I think, ladies and gentlemen, what we've seen this evening is a great example of research that's going on both at the scientific end of the spectrum as well as at the community end and everywhere in between. And what's also wonderful is the opportunity that some of that research can be then put into practice. We're learning from that research. It gives us evidence to make changes and developments that influence the quality of the work we do. And so I'd very much like you, if you could, just to thank all of our presenters for a wonderful journey through COVID-19. Thank you.